everyone. Welcome to our 8th virtual town hall panel. These panels are sponsored by the City of Steamboat Springs and Routt County in partnership with the Steamboat Pilot in Today. My name is Lisa Slitchman and I'm the editor at the newspaper, and I'll be serving as moderator. Today's panel is truly virtual as we're all participating from, I think, maybe a couple of offices home through Zoom. And we felt that it's more important than ever for people to self-isolate and stay at home. So we are modeling that for our audience. And I would remind you, if you're out and about, you're also supposed to be wearing a protective mask as well. So the more of us that do that, the sooner we can help flatten that curve and get to the other side of this. Today's panel features 4 nonprofits in our community who are serving various populations during the COVID-19 crisis. And one of the goals of this discussion is to connect people in need with resources that are available in our community. And these nonprofits and these nonprofit leaders are working really hard during this time to provide for resources for the people in our community. So we will start by introducing our panelists. First, we have Steph Einfeld, a CEO of Northwest Colorado Health, Lisel Petis, Executive Director of Advocates of Routt County. And if you guys want to wave, Steph just, okay, there's Lisel. And then we also have Mindy Marriott, Executive Director of REPS, Reaching Everyone Preventing Suicide, and Nelly Navarro, Executive Director of Integrated Community. So thank you all for being here, and we're going to jump into these questions. And I will say many of these questions we invite people from the community to send the questions in to the city and the newspaper. So these are questions that people have been asking. So we'll start with a general question that I'll give each of you all an opportunity to answer. Please tell our audience a little bit about your nonprofit and what you do. So let's start with Steph.
Sure. Good morning. And Lisa, thanks for having me. Northwest Colorado Health is a nonprofit healthcare organization, and we span several counties in Northwest Colorado. And we have the mission of improving the quality of life for all Northwest Coloradans. And we do this through health and wellness and a myriad of services that we'll get into. But one of the main things is that we really act as the safety net provider for several counties, meaning that we will provide services regardless of ability to pay, language, race, sexual orientation, whatever demographic you can think of, we will serve all people that live here. So.
Great, thank you, Steph. Mindy, tell us about REPS, please.
Thanks, Lisa. Reaching Everyone Preventing Suicide is a 501c3 nonprofit that's mission is to preserve, protect, and promote life by raising awareness and providing a lifeline of support and healing in our community. We do this in a variety of ways, in a variety of programs and services that we offer that we'll get into. We also serve Routt and Moffat County.
Great, thank you. Nelly, tell us about Integrated Community.
Thank you, Lisa, for having us. First of all, good morning, everyone. Integrated Community is a nonprofit organization, and we are dedicated to serve the immigrant and limited English proficiency population here in our community. Our mission is to promote the successful integration of immigrants and local community members. We do this by providing 3 programs, which are resource and referral. Within that umbrella, we also provide immigration services. We do translation and interpretation for all organizations here in Routt and Moffat. We also have education programs, which are English tutoring for youth and also for adults. We also provide early childhood education for immigrant families. We work really closely with the schools. We do home visitations, and also we provide kindergarten readiness. And we're here just to serve our community, to make sure that we break linguistic, cultural, and systemic barriers that prevent our clients from accessing resources that are available to them in our community. I think in the last few weeks, we have been living at the core of our mission, just educating our clients and connecting them to resources.
Thank you, Nelly. Lisel, tell us about advocates.
So Advocates of Routt County serves victims and survivors of domestic and sexual violence. Our services include a 24/7 crisis line. We also have an email for that crisis line. We have a confidential safe house, so anybody who is leaving a violent situation and has nowhere to go, we can house them for a limited period of time. We also do one-on-one advocacy services, which include things like helping people get civil protection orders, helping them understand the criminal justice system, helping them find housing, financial assistance, anything like that. We also do goal setting and help people with coping skills. And then we also do a social change program, which gets us into the community to try and end the violence before it happens.
Thank you, Lisel. Steph, the next question will direct to you. What services are offered through Northwest Colorado Health?
Yeah, so as I said, we offer a myriad of services for all age groups. That kind of breaks down into 4 categories. One is our clinics, and we have clinics in Routt County and Moffat County, and we provide primary care services, behavioral health services, and dental services in the clinics. We also care for patients in their homes, and that's with our home health and hospice programs. And then we operate the Haven, which is an assisted living facility in Hayden. And then our final bucket is our prevention services. And that is really a collage of many small programs that are focused around prevention and education for the community. Our model is integration and support. So we do things like assist patients with navigating Medicaid enrollments and assistance programs, where to go for social services such as food or housing. So we really focus on a wraparound service for our patients where the patient is at the core and we're helping them navigate the health system.
Thank you. Thanks. Mindy, the next question is for you. What can we do to support those people in our lives that we know have a mental health condition during this time?
Absolutely. First and foremost, I want to recognize that any change that we experience and don't have control over impacts our mental health, and that can be difficult to navigate for anyone right now. However, in this uncharted territory, like we're seeing, this can cause major impacts on people who are already struggling with their mood. It can create increased anxiety, sleep issues, and just their overall well-being. For people that are struggling with mental health conditions, this can feel really unbearable. And what we want to do is just provide guidance for people struggling with those mental health issues. If you know someone is struggling and you can hear it in their voice, and you've spoken with them and they've expressed that they are struggling with this isolation right now, there are a variety of things that you can do to support them and to support ourselves. The first thing I would say would be to encourage them to talk to their provider. More than likely, they have a personal care provider that they've been working with, or a professional that they've been seeing regularly. If they haven't, they can reach out to Routt so we can get them connected with that. We obviously know that mental health and physical health are interrelated, so we encourage people to stay physical. We're encouraging people to stay focused on what they can control. These are things like what we're eating every day, how much sleep we're getting, if we're consuming alcohol, how much, and again, exercise. And finally, just encouraging people to stay connected with one another, especially our elderly and our youth. Reach out to family, friends, call them, set up Zoom calls, do whatever it takes right now to reach out to the people that you're most concerned about.
Mindy, thank you. Yeah, I know Zoom has become a lifeline to stay in touch with those that we love. So thank you. Nelly, this next question is for you. Routt County has a large community of non-English speakers. or individuals who have English as a second language. What are you doing to connect with these groups and ensure that they have the information they need to navigate this COVID-19 crisis?
Lisa, that's a really good question. Integrated community for many years has been the go resource for many organizations to be able to communicate with limited English proficiency speaking population here in Routt and Moffat. So with COVID-19 happening, we have been translating a lot of documents coming from the county, the city, different organizations, schools, public health. So we are pretty excited that we're getting those documents to be translated, because that means that those clients of us are getting information in their native language. But also as an organization, my team and I were brainstorming about what is the easiest way to just make sure that everybody is included and informed about what's happening, since changes are happening so quickly. And so with that, a few months ago, we started a group. It was one of Integrated Community staff member idea to put together a group of Latino leaders. And these Latino leaders, they would be given professional development opportunities to maybe become the next leaders in our community. With COVID-19 happening, we decided to kind of shift what we were doing to focus on giving information to Spanish speaking. So with that, we created this group called Yampa Valley Latinx Network. And it works in collaboration with Integrated Community. 4 of our staff members are part of this group. And so we created a Facebook page, and we decided that it would be a good idea to just give short video updates every day about what's coming from the county, the public health, and the city, to be able to make sure that we cover all the gaps. Within our clients, we have a good amount of people that don't read or write in Spanish. Not because they're not smart, they're super smart people. They just didn't have the chance to get education in their countries. Or for people like myself, I'm from Peru, and we have a lot of people that have dialects within their countries. So Spanish comes as their second language. So reading just becomes really challenging. And that's where we had the idea to create these videos that we upload every day. And we also partner with different organizations to make videos of resources available to our clients. So with that, we feel like we cover the gaps and nobody's left behind. With that being said as well, we are reaching out to the state level, and we're working really closely with the Latino Community Foundation about resources they're coming from that state level, as I said, to be able to connect clients to those resources. We're also informing our clients about the repercussions that applying for benefits or any resources right now will have on their immigration status, as we are a recognized organization under the Department of Justice to be able to help clients with immigration services. So we are doing a little bit of everything, trying to cover, and we keep on getting feedback from clients to see where those gaps are.
Thank you, Nelly. Great work. Lisel, we have all been asked to stay at home during this COVID-19 outbreak. How could this particular order to stay at home impact people who are victims of domestic violence?
So unfortunately, we are already seeing across the globe a great impact on victims of domestic violence. We're seeing kind of 2 pieces to it. First, you have victims who are stuck at home with their abuser. So they may not even be able to reach out for help if they need help. If somebody's within their home, they can't really be calling somebody at that same time because they could be overheard. A lot of victims will get help because somebody will notice something's going on. So they're going into their work and a colleague asks about what's going on, or a friend. And so if they're not going out and meeting with other people, they may not have that, that line of intervention for somebody to kind of help intervene and help get them help either. So that's one of the main things that we're seeing as an issue, and one of the reasons why we're really trying to promote our SafeLine email right now, which is safeline@advocatesrc.org, because it will give people an opportunity to at least email us if that's an option, rather than being able to call our crisis line if they need help. The other thing that we're really seeing is that because of all the external stressors that are going on right now, whether it's just the panicked feeling about the health crisis. It could be a job loss of either the victim or the abuser, but that external stressor is causing higher intensity of abuse within the home. So, you know, something that could just kind of set somebody off and really just bring on the abuse. And those are some of the big external stressors. Two people being in the home just in general can be a stressor. We're also seeing an increase in what we call situational domestic violence, which domestic violence is really based upon a relationship of power and control, where you have one person trying to control the other, and they use different types of emotional abuse, physical abuse, mental abuse to do that. Situational abuse is when there is a stressor and something, because of that stress, causes an abusive episode. It means that it is not a pattern, it's not ongoing. It's not as common as domestic violence, which is an ongoing pattern, but what we are seeing now is people, because of these stresses in life, are having kind of these episodal domestic violence things as well. I will say also, this is not necessarily my area of expertise, but we do certainly have concerns about child abuse as well at this time, because kids are at home with their parents. Like I said, the extra stressors, kids aren't going to school. A lot of times the schools are the first line of intervention for kids too.
Thank you for sharing that. And it's something for us to keep in mind, as you know, many people do, you know, celebrate the time with family, but it also can be a difficult time. So, Steph, this next question is for you. Are Northwest Colorado health programs open to different ages, income levels, and cultures? And how can people access those services right now?
Yeah, that's a great question. First of all, yes. We offer services to everybody at all age, especially our community health centers, which is the primary care, behavioral health, and dental is open to any person that walks in, regardless if they have a pay source or not. And we do have interpretive services in all of our programs, so we are able to do interpretation even over the phone or a screen time visit right now. There's really, as far as accessing, there's really no wrong door. Our website lists our office numbers, our office in Steamboat, 879-1632, but you can call our office and we're taking same day appointments. We're taking triages over the phone. And during COVID-19, our goal is to maintain the needed services, but also reduce exposure to our staff and to patients. So in order to do that, we've rapidly moved to telehealth for anything where it's medically necessary. We are seeing patients in the offices as well when they need to be seen in person, but we can do most of what we're doing over the phone or with a visit over a screen. I think it's important to call first instead of just showing up if you need a visit, just to minimize exposure and stay at home as much as possible. So that's the one ask, but right now we're really able to get people in almost in real time.
It's good to know. Thank you. Mindy, if I know someone is thinking about suicide, what should I do and how should I approach that person?
Great question. First and foremost, don't be afraid to ask the person the question, are you thinking about suicide? Or are you thinking about ending your life? It's actually a lot harder to do than you would think when you're in that moment, but it is imperative that you ask the question. Whether you're face-to-face with someone or over the phone, asking the question is extremely important in gathering the most important piece of information. You know, contrary to what people believe, asking the question does not put the idea in someone's head or is insensitive in any way. And the data actually shows us that if someone is thinking about suicide, listening to another person ask them if it's crossed their mind is actually a relief for them. You're validating them. You're validating those feelings that they have. Those that have not had suicide ideation will tell you right away. However, if the answer is yes, and they are thinking about suicide, providing compassionate support while connecting them with immediate crisis professionals is the most important. And some of those options are obviously reps, our direct line, the new MindSpring support line, or the Colorado Crisis Services hotline, which is also, you can call or text. So there are a variety of ways you can get somebody connected. And if you are in a desperate situation, we have been asked to still utilize our emergency department and bring people in the emergency department right away if they've suffered from, immediate suicide ideation, or even if there's been an attempt. And it's also important for me to mention that if you can remove any lethal means from them right away, that creates more of a success from limiting those exposures to people over time and them hurting themselves. And if you're not comfortable or in a position to help with removing lethal means, you can call reps, or you can certainly call our local law enforcement for assistance. And lethal means, can mean prescription drugs, firearms, things like that.
Thank you, Mindy. Nelly, I would assume clients, individuals are not the only ones using your agency right now, your nonprofit. What other groups or agencies rely on your organization?
Absolutely. I feel like in these days or lately or always, we have most all organizations relying heavily on integrated community to be able to communicate to their immigrant population. So we have been working really closely with DHS and Lift Up to create a workflow about how to be screening clients for the services that they might be eligible for. So the case managers at Lift Up and also at DHS have been wonderful to help us develop a plan on how do we connect, put the pieces together. We are also working really closely with the schools, as I said before. Two of our education staff members are the point of contact for Soda Creek, Strawberry Park, and the preschool. If teachers, now that classes are virtual, if they need to communicate to parents or they need to help them navigate through the virtual classroom setting. We also are providing our 24/7 interpreting line, meaning that it's a good resource for agencies to have if they need to communicate with clients after hours. But basically, we are working with everyone in the community, from nonprofits to law enforcement to city, county, mental health. We're able to provide interpretation in several different languages, including English, Portuguese, Russian, and French. So right now we're of course not doing in-person interpretation because we want to limit exposure, but we are very proud to say that we are able to create more work for the people that normally do interpretation for integrated community as a second job. And now that they have been either laid off or their hours have been cut, we're able to provide more work for them. So I think we have had restaurants approaching us because they need paperwork translated, so they're able to communicate to their staff. And so right now it's a good time just to remind everyone to use integrated community as that resource.
Thank you, Nelly. I can't imagine how busy you are right now. Lisel, your organization is working with an at-risk group during this pandemic. So what specific services do you have to help protect these individuals while they're in kind of this self-isolation mode?
So first we have our shelter. So if anybody is in an abusive situation and they need to get out, we do have a shelter to put them in. When people are in our shelter, we also do help them with basic needs such as food and clothing while they're there. And then we also have our advocacy services. We can provide some of those advocacy services over the phone or through email through our 24/7 Safe line. The phone number for that is 970-879-8888. And then also that email, which is safeline@advocatesrc.org. Through that, we can do safety planning for people. So whether they are living with an abuser or not, we can help them come up with a plan to keep themselves safe while in that situation. We also can help with just coping skills. We do not have licensed therapists on staff, so we do refer those out to other agencies, but we can help with just immediate coping skills to help with what's going on in the here and now. For something more permanent or something that's a little bit bigger that may be needed, through our advocacy services, we can help with civil protection orders. So the courts have continued a lot of jury trials and other types of court hearings, but they are still seeing civil protection order hearings immediately. So that is certainly something we can help with. We can also help get victims in touch with law enforcement. If they are scared or nervous about calling 911, we can help make that connection and we can answer questions for them to let them know what that process looks like before they do that. Generally, we also will go to the hospital for forensic exams if people have recently been sexually assaulted or strangled or physically harmed. However, right now, because of COVID-19, we are not accompanying people there. We do ask victims to call ahead of time to make sure that they can best be seen there, but we will talk with people over the phone and make sure that we can still get them all the information they need if they do want to go to the hospital for a forensic exam. So I think those are most of it. We are also, right now it's Sexual Assault Awareness Month, and obviously that's not really at the top of everybody's mind right now. But unfortunately, just because there's a public health crisis doesn't mean that domestic or sexual violence goes away. So we are doing a lot of online work right now just to get the word out that, that we are here. We are here for survivors. We believe in survivors, and we're ready to support them however we can, regardless of what's going on in the world.
Thank you. Steph, how important is access to health care during a crisis like this?
Yeah, Lisa, it's crucial. We need to maintain continuity of care as much as the circumstance can allow. At the forefront of the crisis, it's crucial for testing and care of patients that may have or do have COVID-19. But it's also important to remember that even though our daily lives have drastically changed and some things have slowed or been canceled, other health conditions haven't. They still exist and can present themselves during this time. There's still babies being born. People with diabetes still need to measure their A1Cs. People should absolutely have access to behavioral health right now. So there's all these diseases that still are persisting, and we would encourage people to still access healthcare as much as they need. It's not a time to not listen to your body at all. It's critical that we retain our operations during this time. And I think maybe even more so, especially when we've seen an increase in change in status of jobs or change in status of health insurance, because we still need to be accessible in order to assist Medicaid enrollments and other programs. So I think the message here is please don't shy away from listening to your body and still reach out if there's something needed that's not COVID-19 related.
That's good to know. Thank you. Mindy, has reps seen an increased demand for services during this crisis? And why do you think that is if you have seen an increase?
Mm-hmm. Absolutely. We have seen an increase in about 60%. So to put things into perspective, we have roughly 17 people in our community right now being seen a counseling program with a professional provider. And last year, in the year 2019, we saw 27 people total. So we are really feeling it right now. But we expected it as well. And, so many people, I think, because of what's happening, they're feeling, major stress, concerns about becoming sick, uncertain about their future, obviously financial strain, job loss, relocation costs, and just overall dramatic changes in our daily routine. Especially for those in recovery, people are feeling even more isolated than ever before. Those groups that were there to help rise them up are no longer there, maybe virtually, but for a lot of people, that's a huge struggle. So some of the things that REPS has done is just to increase our social media, created creative outlets for people to meet through our suicide prevention support groups, and our youth suicide prevention support groups are still ongoing through Zoom. So if people are interested in that, please reach out. We're also trying to increase our advertising in terms of education and awareness for our community. So really providing increased suicide prevention specific education for people and things to look out for.
Thank you. Nelly, we know that many members of our immigrant population are among those essential workers who are still working, maybe at the grocery store or on a construction site. So what has Integrated Community done to help support those workers and help keep them healthy?
Absolutely. At Integrated Community, we believe that immigrants are the backbone of our economy, and we can see that right now with the frontline people, at the grocery stores, construction site, as you said. And we believe that the first step to be able to keep our community healthy is to provide that education piece we were talking about, to make sure they know what the guidelines are. We have been working with different employers and developing a plan on how and translating those documents to be able to facilitate communication with their employees and know what resources they have to be able to take care of themselves. With that, we work case by case with each individual as well with our resource and referral program. Our resource and referral coordinator, he is amazing and does wonderful work here. And just to I would like to share his number. It's 970-819-0190. If any employers need documentation translated to be able that everybody's getting that messaging, please call 970-620-1513, or you can send documents for translation requests to translate at ciiccolorado.org. And then we're also able to assist clients that are essential workers with childcare services that are provided to them. If they have to go to work, then we connect them to make sure they have someone to watch their kids while they're at work. So yeah, it changes a little bit with each individual, but education, we believe it's the first step.
Thank you. Lisel, and you mentioned this at the last question, but advocates also serve survivors of sexual assault. And so I think there's a thought with nightlife shut down that maybe sexual violence isn't still occurring. So first of all, how would you answer that? And then secondly, how are those victims being served at this time? My fear would be that maybe they would think with everything going on, they shouldn't come forward. So how would you address that?
So while we do see the number one type of sexual violence being drug-facilitated sexual assault, which really just means that either a drug or alcohol was used to incapacitate the victim to take advantage of them. Because of that, we do see a lot of that originating out of bars, but that isn't the only way it happens. In fact, the majority of sexual violence cases, the offender is somebody you know. So whether it's a friend, coworker, boyfriend, husband, that is actually the number one type of perpetrator in somebody's life. So even if people aren't at the bar, if they're drinking, that can still happen in a home. People are supposed to be doing stay-at-home orders and social distancing, but if it's your roommate or a boyfriend, you may not be taking those same precautions, obviously. And then, you know, there's plenty of times that, in fact, I would say almost the second type of sexual violence we see is within a domestic violence relationship. So those are two people who are cohabitating anyways. So, you know, it's, I don't know, the optimist in me says that maybe we will see a slight decrease, but it's not going to go away, unfortunately. There are absolutely still services for victims of sexual violence right now. Patty Oakland, which is our forensic nurse coordinator up at UC Health, YVMC, I just spoke to her the other day. She is still doing forensic exams as needed. Different precautions are being taken. You know, generally before you could just kind of show up, we would come on scene and help, but they are asking that that person calls ahead of time. And then, like I said, we will be providing our services by phone right now. So it's not the best services that we would like to provide, but this is, you know, I still want to encourage people to come forward because they will absolutely still be helped. If they do want to report to police, police are still going to take this as one of the top priorities. So, yeah.
Thank you. Now I'm going to go to a series of questions that really I would love for, if you guys feel, all of you to answer. So the first one, Steph, we'll start with you and then kind of let everyone answer. But what type of needs and demands are you seeing most from the community right now?
Sure. Yeah, there's, I would say there's several. We've already kind of spoken to behavioral health, but we're seeing that in our clinics as well. I believe it was last week, we saw more patients in behavioral health than we have all year. So obviously that's a higher need demand. I'm very proud to say that we transitioned to telehealth. That was one of the first services we transitioned to telehealth almost immediately. And so all those consults are happening over the screen or over the phone, and we are able to take new patients. And so I think we're really proud to be there for the community in that way. We had one of our practitioners actually in one day, she saw, quote unquote, someone from Oak Creek, Steamboat, Maybell, North Routt, and Hayden all on the same day, which doesn't happen under normal circumstances. So that was actually a pretty cool success story. But it's definitely a growing need, and I think you've kind of heard that throughout this conversation. The next need that's risen is the need to maintain or obtain health coverage right now. I think we all know there's a shift in the unemployment rate, and one of the scary parts of this is the loss of coverage or the loss of income to be able to pay for it. So we're seeing an increase in Medicaid enrollments, and we're also seeing an increase in patients who are coming to us that are uninsured or underinsured, which, you know, to us, it's great because that's why we exist. We're here to serve those people. So we really want people to feel encouraged to reach out. An interesting thing that came up, I believe a couple days ago, was that we are still doing urgent and emergent dental care, which is all that is basically allowed if you're following the guidelines of the CDC. And I believe most offices have shut down in the communities, but we're still seeing people. So if there's a dental emergency, we're still here for you for that. And you know, that's right now, this is ever changing. So we're kind of planning and preparing for what happens when there's a caseload surge in about 2 weeks or so as predicted. And in that case, we'll anticipate a higher need for home nursing, physical therapy, occupational therapy, as those patients that have the more severe COVID-19 cases may require those services as part of their recovery. So we're balancing trying to be there for the community as much as possible and also preparing for what's needed next.
Thank you. Mindy, is there anything you would add as far as, you've mentioned it, but needs and demands that you're seeing most from the community?
Right. So like I mentioned, our demands are they've increased significantly with calls. People in crisis struggling with anxiety, their mental health or behavioral health condition. We've also seen an increase with family members, friends, or loved ones emailing with referrals for people. And that's wonderful. Like Stephanie said, to her point, that is why we exist. So we are here to help every single person in this community free of charge take control of what's happening in their life right now. Some of the needs that we're seeing are obviously increased education and awareness in the community. We encourage people to go online to our partner site, LivingWorks, and educate themselves on, suicide prevention as much as possible right now. We can also use volunteers. Utilizing our volunteers has been amazing. We have an incredible group of compassionate and skilled individuals. And if you are interested in that, we could certainly utilize your help. Finally, I would say that funding is certainly a need. We were at about 60% of our budget at the end of last month when it comes to providing these free services to people in need. So I just encourage everyone, to find a way to give, volunteer, and whatever feels right for you.
Thank you. Nelly, do you have anything along those lines to add about needs and demands?
I would say that what we have seen at integrated community, the biggest demand is the need for housing payment. People are really concerned about not being able to pay for rent at the end of the month, which makes sense because, rent and housing is the biggest expense that we all have. So I think with food, I think Left Up, Snowball, and different organizations and the schools are doing a fantastic job. And so we haven't seen a big need for that. We're just basically just connecting those people to the right places to go. Also, another big need that we have seen in our community or within our clientele is the need to navigate the technology. So a lot of these forms or applications that they need to submit, they either have to be printed out and then signed and then sent back or scanned back. So technology is a big barrier for a lot of our clients. So if we have clients calling because they need to get connected, we spend double the time working with them because of the technology piece. So I would say that's a big need. I'm glad that the schools were able to provide computers. I think they provided over 300 computers to students, which has really helped not only the student, but the family as a whole to be able to have access to a computer and be able to submit paperwork and apply for different resources that we do have available right now. Another big need, it's, as I mentioned before, is the need of translation of documents. Daily we're getting 10, sometimes 15 documents that need to be translated, and those have to happen in real time because, as we know, COVID, the regulations and guidelines are changing constantly. So that's another big need for us.
Thank you. Lisel, you.
Yeah, we've seen two big needs. I'd say the first one is for financial assistance. A lot of victims we work with are kind of forced to go back to their abuser because they can't afford their life for themselves and their kids. And so they're facing this idea of, do I need to be homeless or do I go back to my abuser? And unfortunately, a lot of them end up going back to the abuser because they don't want to live in the car with their child. So with people losing their jobs, that is by far the biggest need we've seen is financial assistance. We are working closely with other agencies in town to help provide that need. And then we also have our own little pile of money actually donated by Alpine Bank to help any victim who needs immediate help with a bill of some sort to make sure that they can continue to live a safe and successful life. The second need we've really seen is a lot of people are living in isolation right now, and that is causing anxiety, it's causing depression, it's which I'm sure probably everybody on this or in this town hall has seen. And so to me, it's making sure that you reach out to people in your life. That goes for people who live alone, who are with their family. If you haven't heard from them, I would highly encourage you to reach out just to make sure they're okay. Just check in and keep that social connection going so that they know that they're not alone.
That's very good advice. The next question is maybe a little bit along those lines. So Steph will kind of go in our circle around again. But So if I have a friend, a neighbor, someone that I know is struggling, how can I get them help?
Yeah, great question. Great question. And there's so many variations of struggle and what that could mean, right? And I think, I'm grateful to be able to say that there's really no wrong door, regardless of what support is required. The community's nonprofits and government support systems work together so closely on a regular basis, not just now, but especially now. We've come together more in this emergent state, and I think we're all very aware of what each other does and know how to get you to the right resources. So the important thing is just to encourage that person to reach out if there's a need, and also maybe follow through, check in on them, and just make sure that if there is a need that's identified, that they've reached out, or maybe you reach out for them and you can help them navigate that. I think one of the silver linings throughout all this is all of the community support that we've all seen with each other from the nonprofit level, but also just from the personal level. I mean, I think people are really, one, we all have the time now to do the things that we love to do and help people. And two, I think there's a bigger connection right now. So I would say just keep following up on them.
Thank you. Mindy, what advice would you have for someone who wants to help a friend or neighbor?
Great. I just want to speak to Stephanie's point that all of the health and human service agencies right now are collaboratively working together harder now than I think we ever have been. And it has brought the sense of unity even more so to all of our organizations. So that's been amazing. I also want to mention that if anyone is struggling with suicide ideation, specifically, all of our services are 100% confidential. So even if you don't want to reach out to reps directly or email us, you can choose a provider of your choice or go speak with anyone in town and explain to them the symptoms that they're having and let them know that they would like to be seen on the reps referral program because it is a small town. And we all are so interconnected. And I just want to make it very clear that all of our services are confidential. 9 times out of 10, I don't even get the information from the provider other than a set of initials on and an age on who that person is. So if that's a barrier, I want to let people know that, again, 100% confidential and completely anonymous if they're choosing to be seen in that capacity. We just want to encourage everyone to get the help they need, regardless.
Thank you. Nelly, how about you? What advice would you have on if someone's wanting to help a friend or neighbor who's struggling?
So I would just also add to Stephanie and Mindy's point that HRC, which is the Human Resource Coalition, has been working really closely to make sure that no gaps are left out, and then we are not duplicating services, that we're connected, that we know what each other is doing. I would say that all organizations are working really closely together, which is beautiful to see. And within the population that we serve, which is the immigrant community, we have been really pleased to see that there's a big network of immigrants supporting each other, referring a friend. I would just try to say to people who are not familiar with the integrated community and our services, if you know of someone, a friend, a coworker, someone that is struggling, please refer them to integrated community. We have amazing individuals, very compassionate through these times, helping everyone with whatever the needs are. We have also been really pleased to see English-speaking population approaching integrated community for services. And because we are so connected with other human organizations, agencies, we have been able to also refer those people and give them the help they need. With that being said, as Mindy said with reps, our services are also confidential. Whoever comes to the door, a lot of people are concerned about citizenship status or things like that. We serve people. That's all we do. So if you have a friend that needs our services, please send them to us. we also got some money to be able to provide translation services. So if any organization needs those, please send documents to translate at ciiccolorado.org.
Thank you, Nelly. Lisel, what would you add to that?
I do want to just reiterate that our services are also confidential. So I think, in fact, most nonprofits in town have that. You can always ask before you call, is this confidential? But at Advocates, we provide services for both primary victims as well as secondary victims. And we include anybody as a secondary victim that knows somebody who has been victimized. So if a friend or family member wants to call us to ask how to handle a situation or ask questions on behalf of that person, we have done that plenty of times to help people help other people. And then I'm going to reiterate as well, which has been said very well, is all of our agencies work so closely together. You could call any one of us and we will make sure you get to the right agency to help you. So even if it doesn't have to do with domestic or sexual violence, you can call us and we will get you to the right place. And I know pretty much every agency works in that same capacity.
You all have been sharing about all the services that you provide to the community. So I want to give you an opportunity to tell our audience if someone, we have a lot of people that do want help during this time, and maybe they can't physically volunteer. So how can someone best help your organization? Steph, let's start with you and then we'll go through that.
Sure. Yeah, I think first I would say we've already seen just an outpouring of love from this community. One of the ways that showed up was, we have a pretty strong volunteer base, and we had a lot of volunteers that sew. And so they were able to make masks for our teams in the case that we ran out of the medical masks that they could use. Even Big Agnes sewed a bunch of masks for us, which was it was fabulous. It was great to see. I think that any one of us would say that funding is a constant struggle, right? We're nonprofits. Our organization specifically chose to move forward with telehealth because we felt it was the right thing to do to keep our patients safe and our staff safe. We did that, but we did it knowing that we wouldn't get paid for some of these services by some insurance companies, by Medicare in some cases. So absolutely, any financial help to support us supporting our community during this time is greatly appreciated. I think another easy thing to do is simply for people to share what we do through word of mouth. We work to reduce any barriers to accessing care. And at the same time, we know that there's still people in this community that aren't connecting with healthcare professionals. And they're not seeking health services. And so I think one of the best ways that anybody can help us is just to simply talk about us.
Thank you. Thanks, Steph. Mindy, how can someone best help reps? I'm sorry, Mindy, how can someone help reps?
Absolutely. Well, first and foremost, I'd just like to encourage the community to educate themselves about suicide prevention. We have training online through LivingWorks that I mentioned earlier. So there are several programs online where you can increase your knowledge about suicide prevention specifically. The second one would just be share positive messaging, like Stephanie mentioned. Spread the message about reps and our resources to as many people as possible. Even if you don't think they're struggling, it's still really nice for people to be aware of all of our services that we're providing. And then obviously, finally, funding is critical right now. And it would certainly be helpful during this time to not ever have to turn anyone away for services because of lack of funding. So.
Thank you, Mindy. Nelly, how can people support Integrated Community?
Integrated Community is looking for volunteers to work with our tutoring programs. we have seen that, and I can speak from just my personal experience at home. I have a 5-year-old, and my husband and I only speak Spanish to her, and she's already forgetting some of her English, which happens really fast. They get it really fast and they forget it really fast. So we are trying to build more capacity to be able to support those kids. And so when they're ready to go back to school, they haven't lost their English skills. And support families for that matter. We have seen a lot of people reaching out to integrated community to offer support in different areas. So that has been just really beautiful to see as well. Also funding, it's a big element for all nonprofits to help us continue with our mission and supporting our communities throughout. And same as Stephanie and Mindy were saying, just talk about us, say that we're here to serve our communities. If you have friends, I think most of us do have someone that struggles with the English barrier, so please don't be afraid to refer them to integrated community. We're here to support our community.
Lisel, how can people support advocates?
It's going to sound a lot the same as everybody else. First is spreading the message of how we can help the community and making sure they have ways to reach out to us. Generally, all of our organizations are getting into the community, doing presentations, trying to really blast that out, and we don't have that ability right now. So the most we can do is really through social media, email, and we can't hit everybody. And so we really do need the community to help spread that message because suicide, health issues, domestic violence, it affects everybody in our community. It doesn't matter what your class, race, gender is. And so just getting that word out there. I would say the second piece is really going to be funding, and that is not just for advocates, that's for every single nonprofit organization throughout Routt County. I know all of us are a little panicked about what's going to happen with individual donations this year. The stock market is volatile. People aren't able to work, they're getting laid off. And so all of us are worried about, can we continue to serve our community at the caliber that we have been? And that's not even just human services. I mean, a lot of arts organizations had to shut their door. And I will tell you, a lot of our clients go to arts in order for self-care and making sure that they stay connected and have a social network. So to me, find organizations you love and make sure to give now. Don't wait till the end of the year. Don't wait till Colorado Gives Day. Just give now so that we know that we're going to continue to be able to serve our community like we need to.
That's great. Thank you. It looks like we are coming to the end of our time. So I want to give you guys each an opportunity to kind of, say something in closing that maybe we didn't touch upon. So we'll go ahead and let Steph start just with a closing remark of some sort.
Yeah, sure. Thanks. Well, Lisa, thanks for having us. And I really want to take this time to publicly thank each and every one of our team members at Northwest Colorado Health. Healthcare is obviously essential right now, and they have been working nonstop in order to serve the community. And it's hard, but they're resilient and they're dedicated and their hearts are in it 100%. So I'm so proud to be part of this organization. So just want to thank them publicly. And then at the same time, I want to offer my gratitude to our community. I think I said before, it's one of the silver linings that I've seen is just the outpouring of love and support and the sense of community here. I've lived here for 17 years and I've never felt this so much of a strong sense of community. So it's really cool. It could be all the people I see walking their dogs all the time. But I think it's really just our small mountain town coming together to take care of ourselves. So it's really cool to see. So I just want to offer my gratitude to the community.
Thank you. Mindy.
Absolutely. Lisa, I just want to end by thanking you and your team for just providing this collaborative effort to educate our community. I've heard from many people recently that they hadn't even heard of our organization until now. And this is truly a perfect example how we can work together and create positive messaging and education for many of our community members. So thank you. Secondly, I just want to say that we can all do things to help support our mental health in this time of change. And by doing that, we're encouraging others to make their mental health a priority no matter what is changing around us. So my final message would just be to the community to make your mental health a priority and don't be afraid to reach out during this time, because we're here, our services are here, we're not going anywhere.
Thank you, Mindy. Nelly.
I would just like to say again, thank you to the Steamboat Pilot and today for providing this opportunity to talk about what each of us do in our communities. To thank our communities, I also want to take the time to thank my team. They are wonderful people. They are really shining right now through this crisis with such a compassion. I want to thank our clients also for seeing integrated community as part of their team, which is super important to us. And just this is I think that we have to do together as a community. So let's make sure that we involve everyone, and that means our immigrant community. Thank you.
Thank you, Nelly. And Lisel, we'll let you end the forum with your thoughts.
I will ditto the thank yous to everybody that's participating in the town halls and also our community. And then the last piece I just really want to plug in is we want to make sure people are doing self-care, and this goes to the mental health piece that Mindy was just talking about, whether that's going outside at a good social distance from other people, or spending time on a Zoom happy hour, reading a good book, whatever it may be. People are feeling isolated, they're feeling stir crazy, they are having issues at home, and the best thing you can do for yourself is take time for yourself so we can get through this and then really be better on the outside.
Well, thank you all very much. I hope everyone who is watching feels gratitude for what each of your organization does for this community. You all are sometimes touching some of those most vulnerable people that sometimes maybe we don't always think about. So thank you for your efforts and for your team members who are working so hard during this time. We'll continue to do this on Tuesdays and Fridays virtually. Our next topic will be hospital preparedness, and that will be Friday. So if you have questions, please send those to covid@steamboatsprings.net or news@steamboatpilot.com. And I also want to do a thank you. I'm the one moderating, but Winnie De La Quadre and Mike Lane from the city work really hard to help coordinate these panels. So I want to give a shout out to them. Again, we are in this together and we will get through this together. So thank you all for your interest. And I hope you keep watching these, and these are helpful. And again, continue to send us ideas for future panels. Thank you all for your time.